Evening, guys. Welcome to Gut Over It. This is Dr. Vivian Asamoah. I am so sorry I am late. This was not intentional. I spent the last 20 minutes trying to figure out how to zoom in with Zoom Live to stream into Facebook, and that has been hard. So I didn't do it. And I said I wasn't going to just drop all of it. I was this close to dropping it all because I prepared some awesome slides about hemorrhoids, but I figured, rain or shine, let's do this. And let's do this. So I was going to talk about hemorrhoids tonight, and we're going to make this quick because we don't have a lot of time. But I was going to talk about everything in the anal area, right? Starting off with hemorrhoids. And I know that a lot of you suffer from hemorrhoidal disease, which are also known as piles. And let's just talk about everything we can see in the anal rectal area. Like, I had such wonderful slides. I'm so disappointed. My good scribe and assistant, Evelyn, helped me put it all together. So I will try and get these slides together. And maybe I'll do a replay and have the slides, the images showing close by. But I think everyone wants to hear about hemorrhoids and anal rectal issues. So let me actually start with, I'll do the reverse. I'll do the stuff that's not common. How about that? Okay. So if you have anything oozing out of the anal rectal area, like you notice that every time you wipe, or if you press a little pimple, sometimes it'll start with a little pimple and you press it and ooze and push it together, you'll notice purulent discharge draining out of it. And I'm talking about this could be really between the buttocks creek or the crease or the really near the anal hole. That could be a purulent fistulous drainage from an abscess. So you can have something called a perianal abscess, and it starts off like a little pimple, just like a little pimple. And then it just, it's a pimple that never goes away, and it just continues to drain. And that's because it started off as just like a little scab, and then it tunneled in deeper. And under that area, there's tissue, there's fascia, there's tissue, and you develop an abscess underneath that just drains. And this kind of drainage doesn't go away. It's chronic over months and months and months. You notice that, oh my gosh, every time I go to the bathroom and I wipe a little bit, there's this pussy discharge. It's not coming from the rectum, the anus, it's coming from the side. You need to see a GI doc, okay? This is Gut Over It. If it happens for a long time, it is not normal. You need to see a colorectal surgeon because it may actually require opening that little scab or hole and then really getting all the pus out so it can drain completely. And sometimes we'll see this in people who have Crohn's disease. Inflammatory bowel disease is very often associated with fistulous drainage from abscesses forming in the perianal area. So if you have anal rectal pain and you notice a drainage periodically on and off, like every 2 days, a little bit of drainage, right? Or even a little bit of bloody drainage, mucousy bloody drainage, and you notice you're having some low grade temperatures, it could be an abscess that really needs to be drained. So take care of it. Because if this is not drained quickly and you ignore it and you think it's hemorrhoids, or you go see your doc and they're like, oh, it's just hemorrhoids, it's hemorrhoids, this actually develops like a little labyrinth path of fistulas that becomes extremely difficult to manage. And you have to see a colorectal surgeon, slice the whole thing open, and have these things called cetons, like little plastic tubes that drainage, and this could be forever, for the rest of your life. And so you just want to take care of it quickly. Moving on up, we talked about fissures, F-I-S-S-U-R-E, a couple of days ago. Those are little cuts, slashes in the anal rectal area that we will sometimes see with large, dry, hard bowel movements. Hey, everyone, welcome to Gut Over It. Nice to see. Oh, I guess you guys were waiting for me. I'm touched. I almost gave up, but I'm so glad you guys held on because this is an important topic. So we're talking about fissures, right? Slashes in the anal rectal area. And that happens when you have a large bowel movement that rips into that tissue wall, and that takes forever to heal. So you'll have an acute fissure it is painful before you have a bowel movement, it is painful during a bowel movement, and it is extremely painful after a bowel movement. So it almost feels like electricity and burning. So if you have an anal fissure and it bleeds, it's painful, you almost don't want to have a bowel movement because you're so scared it's going to hurt. You got to see a GI doc. Gut over it. Don't be shy. See a GI doc. Now, I'll tell you, one thing that we do in our practice, and this is all GI docs. So if you go in with a rectal issue and your GI doc says, let's go to colonoscopy, say, doc, I need you to look. Don't be shy. Just say, I need you to look, because we are trained to look down there. We have little Chuck's wipes. We have little covers you can wear. We have anoscopies. We've got lube. We've got lights. We've got action. So if your doc is saying, no, just, I'll look at it in 4 weeks when it's time for your colon, say, no, doc, I'm in too much pain. Because if you can look with a mirror, right? A lot of patients, they're like, I looked with a mirror, I really tried, but it's hard. Especially if you got a big butt, it's really hard to spread those cheeks. So you must tell your doctor, please take a look. It's part of our job. It's not just colonoscopy, but we can look and actually provide some relief. So we talked about the slashes, okay, the fissures. We can see those very easily when we do an anal rectal exam. We'll see the little cuts, and we can see it's like on either an anterior towards the back or a posterior. And when we put our finger and palpate, our patients jump through the roof, and you can make that diagnosis right away. The way we treat, there are ointments and creams that we can use to kind of reduce and relax the pressure in the sphincter, right? So that everything can heal nicely. And having smooth bowel movements is really important. So going on up, even before we get there, we've got external hemorrhoids. So external hemorrhoids exist on the outside, and internal hemorrhoids usually start inside the rectal cavity and then can drop down. So with external hemorrhoids, these are usually just kind of fleshy on the outside. They become engorged and then they reduce in size. And these usually will flare up whenever you're doing activities like sports and stuff, lifting weights, because you're straining, that straining motion will get those hemorrhoids into external ones acting up. The internal ones start on the inside, and these hemorrhoids are just vessels, right? They're venous plexus that become engorged. I tell patients, hemorrhoids are the varicose veins of the butt, the varicose veins of the legs. Hemorrhoids are basically engorged vessels in the anal rectal verge. So the internal ones start right inside the rectal area, and you've got internal hemorrhoids from stage 1 to stage 4. Stage 4 is the worst. Stage 1 is the smallest. Stage 1 hemorrhoids are just inside. They become engorged. They're inflamed. They're uncomfortable. Stage 2 they're so inflamed that they pop out. Stage 3 hemorrhoids stay out. So they're internal hemorrhoids, but they've grown large enough where they stay out. Hey, so good to see everyone on. Please leave a comment. Tonight's word is, it has to be anal. Anal is the word. So if you're enjoying this, type in anal. If you have questions, let me know. I want to make sure I answer all your questions. So stage 3 hemorrhoids are the large hemorrhoids that become so engorged that they prolapse out. So the tissue comes out with it. And stage 4 hemorrhoids, that's what we call cauliflower hemorrhoid. That's the hemorrhoid where you look at a patient and you're like, surgery, straight to surgery, right? Because we know that grade 1 and 2 internal hemorrhoids, as gastroenterologists, we can put little rubber bands and band them just to constrict the circulation. The hemorrhoids don't fall off, the hemorrhoids flatten out, and you get an ulceration, and it just flattens out the hemorrhoids. But stage 3 and 4 hemorrhoids, the ones that are prolapsed out, the ones that stay out, colorectal surgery. There's no amount of banding that can be done, okay? So we talked a little bit about hemorrhoids, and let's talk about some of the symptoms of hemorrhoidal disease. So you can have rectal pain, rectal itching, engorgement in the area. When a hemorrhoid becomes really engorged and the blood vessels just kind of stay there and become coagulated, that's what we call a thrombosed hemorrhoid. Now, this is a very, very painful hemorrhoid. It's engorged. The clot is trapped in there. And very often you have to start off by either doing like a sitz baths with warm water, or sometimes the pain is so bad that you have to go to the emergency room and get it lanced and get the clot out for it to feel for you to feel relief. So when you have a hemorrhoidal pain that is more severe than you've ever experienced, like you can barely sit down. You know, when we see patients with thrombosed hemorrhoids, they can't even sit. They can't go to work. They can't do anything. And they've tried everything from preparation H to prescription medication. And it's not a fissure. You have, that's actually an emergency. You're in so much pain that you have to go to the ER and get the area lanced, get the clot out, and find relief. But there are things that will trigger thrombosis or clotting in these hemorrhoids, and that includes, people don't know this, but prolonged sitting for hemorrhoids in general. And I think we're seeing more hemorrhoids because people are at home, virtual working, virtual learning, so they're sitting for hours. So it's important to get up periodically when you're at work, walk around. Truck drivers or people who drive long hours to work, long commutes, because of that pressure of sitting will have hemorrhoidal issues, right? People who work out at the gym, weightlifting, right? Doing that maneuver, that Valsalva lifting maneuver with the abdominal pressure, they also develop hemorrhoids. If you guys can think of anything else that increases the risk of hemorrhoid formation, and this should be very, very contact. Anything that increases, I mean, there's one thing that causes hemorrhoid. Everybody should know this. I didn't say it because I feel like everyone should know. It starts with a C, constipation. Constipation is the number one cause of internal hemorrhoids and external hemorrhoids, right? And this is because you just have hard, dry stools that sit in the anal rectal area and cause these hemorrhoids to become engorged, okay? And so drinking water is important, and making sure that your diet is rich in fruits and vegetables. But the number one issue I see when patients are constipated that really makes hemorrhoids get worse is they just sit on that toilet. So learning point here, the average time you should sit on the toilet to have a bowel movement should be literally less than 5 minutes. But we see people sitting for 30 minutes, 40 minutes. Some people say, I've been on there for 2 hours. No, all that does is, although you're not pushing, you're straining and things are just dragging down there. So don't watch Netflix on the toilet, hiding from your children. No, don't do that. Or from your parents. Don't talk on the phone because you could be talking for hours and just sitting on the toilet. All of these things will make hemorrhoidal disease worse, okay? So treating underlying constipation, not sitting on the toilet seat for a really long time, will reduce hemorrhoids. I want to see if anyone has any questions about hemorrhoids, some of the symptoms. You know, some of the common things we all know that hemorrhoids would cause are rectal bleeding, rectal itching. But one thing we don't always mention is leakage, right? When the hemorrhoids are engorged and inflamed, you just feel like you're constantly having to wipe because it just never gets clean. And that's because there's stool kind of sitting around where the inflammation is. So it's one of the easiest solutions to kind of get rid of hemorrhoids or treat hemorrhoids is fiber. Because fiber naturally through the diet, or fiber in the form of a supplement like Metamucil, Benefiber, Citracel, will allow for bulk and soften the stool and ease the passage and bring everything out at once, so you don't have those stool bits kind of still lurking there. So there are many great forms of fiber, and we will actually dedicate an entire evening to fiber. And I promise you guys, I will get this Zoom thing, rain or shine, I will get this Zoom thing working, because I got great slides to share with you guys. I think a picture says 1,000 words, and when we can see it, it's even better. So there's we talked about hemorrhoids tonight, guys. We've talked about fissures tonight. We have talked about fistulas and abscesses tonight. We have talked about one more thing we need to talk about. Now, whenever you have itching, it could be from hemorrhoids, but a good GI doc or a good PCP, when you have itching, will also look in that buttocks crease. And if the itching goes all the way up, then you may have a fungal infection of the anal rectal area. So that causes a lot of itching, and it itches not only around the anal rectal verge, but upwards. And so when you have anal rectal itching and it's fungal, we have to treat with an antifungal, and your diet has to change, eating less sugar and less things that will trigger, okay? So we've talked about many things that we can find in the anal rectal area as chronic disease. The last thing I want to mention is a diagnosis of Proctalsia Fugax. If anyone can spell that, this is the spelling bee of spelling bees. This is the spelling bee of the night, Proctalsia Fugax. And if anyone has had this diagnosis, they know what it is. It is extreme sudden shooting pain in the anal rectal area that occurs at any point in time. It can last from seconds to minutes, but it is extremely painful and it will stop you in your tracks. And we've been trying to figure out why this happens. We think it's some kind of intense spasm and sort of electrical nerve ending stimulation at the anal rectal verge. If any of you have experienced this before, please put a comment in. Let us know how you treated this. But it's really hard to work it up because we don't see hemorrhoids. There's no fissure. There's no abscess. There's no fistula. And usually it's seen in women around perimenopausal time, just before they go into menopause or when they're in menopause. And they describe this as a huge problem. Like, they're at work giving a presentation and there's this sudden intense pain where they have to do deep breathing. And we don't have a perfect way to make the diagnosis. It's really clinical. And in terms of solutions, I have tried so many things, and I've noticed that there could be an association with stress. There can be an association with hormones, right? And that is what triggers these symptoms. So it's just this intense pains. It exists. It is a diagnosis. Sometimes we'll use a kind of a belladonna or morphine-based suppository, or sometimes even a benzodiazepine-based suppository, like a Valium suppository. But a lot of women who have this, or a lot of people who have this, will say, Doc, by the time I go find the suppository to insert, my symptoms have gone. The intensity of it has gone. So that's also a diagnosis to remember. So we're going to keep it short because I know I started late. And thank you all for joining me. I am so happy to see so many people on. I am going to do my best to make sure the Zoom thing works so you can see my fantastic pictures. But tonight was about hemorrhoids and more inside the anus. We talked about a lot of things that maybe you didn't think you had, right? All the way to fungal itching. And so if you enjoyed it, put in a like, share some love, leave a comment, share this with someone who may have anal rectal disease, and make sure, got over it, when you go see your doctor and you have anal rectal discomfort and you're in pain or you don't know what's going on, make sure your doctor there and then, somebody has to look inside that anus. Somebody has to take responsibility and look inside that anus. And that's what we do. At the office of Dr. Asamoah, we always check. We have an endoscopy ready. I mean, I think it's great when you can help a patient say, oh, this is what I see. This is what I don't see. Oh, there's a fissure. It's so reassuring to them because you can't see what's going on. So make sure you get a full detailed exam. Have a wonderful evening. This was Gut Over It. My name is Dr. Vivian Asamoah. I'm a happy gastroenterologist in Katy, Texas. I'm also a functional medicine provider, and it has been a pleasure to be with you this evening. And sorry I was late. I will be right on time tomorrow. I don't know what we're talking about tomorrow, but we will post it tomorrow morning or even tonight, and so you all can join me. Have a wonderful evening, guys. Bye-bye.